I would now like to demonstrate the head thrust test for both the horizontal canal as well as the posterior canal. So, what I'd like to ask my patient to do is to go ahead and maintain fixation on my nose. This is testing the vestibular ocular reflex. So I'm going to go ahead and grab around my patient's ears here, and I'm going to bend them down into the plane of the horizontal canal about 20 to 30 degrees to help sensitize the effectiveness of this test. Again, the vestibular ocular reflex maintains gaze stabilization. So the patient's eyes should not fall off of my nose. If they do, that means the eyes are moving with the head and that there is a defective vestibular ocular reflex to the side I'm thrusting to. So here's to the right. All right, we want to try and switch it up so that way the patient doesn't realize that there's a pattern being established. And we're looking for the ability for the patient to maintain fixation on my nose. Matt has demonstrated negative head thrust test bilaterally. Next, what we want to do is we want to assess the posterior canal. Now the horizontal canal is plugged in basically by the superior vestibular nerve, whereas the posterior canal is plugged in by the inferior vestibular nerve. So this is a way to help differentiate between possible pathology or lesion between those two nerves. So here we're going to position him to the right here and about 45 degrees. Maintain your eyes on my nose, please, Matt. Thank you. He likes the viewers. All right, here we go. We're in 45 degrees. So we pre-positioned them. It's a little difficult. We want to make sure that they're relaxed so that way they don't expect what's coming. And then we thrust in the plane of the posterior canal. Again, negative to the right. You can go to the left. Shake and relax your patient. All right, and just a quick thrust. He's demonstrated negatives bilaterally.